Hi, dear colleagues. My name is Marian Fanica. I'm here with Dr. Galip Gürel. Welcome. In Romania, it's first time?
Or no, many times.
Many times?
Many
Okay.
times.
I'm happy to be here with you. I have a few questions for you before your presentation. My main question will be, what a dentist need in the first place to jump in the digital train? He needs a digital camera, a digital printer. What are your armamentarium of and what are your recommendations for a dentist?
Well, the first stage should be the mental change.
Okay.
Then it's the armamentarium. But anyways, we already switched into digital dentistry since years. Even the way we keep our files is digital. And now we're moving more on the clinical side. And even if you will follow the digital means or analog means, if you're dealing with aesthetic dentistry, definitely you should have a digital camera to start with. You should document your cases to see before and afters, to reevaluate them, and to share it with the patients and with the laboratory. And then, of course, if you want to get some digital results, yes, you do need an intraoral scanner. You do need a CAD/CAM milling machine. And lately, yes, you do need a 3D printer. So these are the main armamentariums if you want to go digital.
And
but a camera to start with is a must.
And the next question will be, the benefits will outperform the cost, the investigation in the...
Well, that's another issue. I mean, if you just buy it as a toy and leave it aside, of course, it's going to be an expensive toy. However, if you put it into your daily practice, of course, it will bring a lot of pluses in many ways. So if you're into digital dentistry, yes, you'll definitely get paid back with all the investments you made into digital armamentarium.
So you have to use it in the first place. Buy it and use it, and
actually, I'm not saying buy it, but there are many laboratories who's been digitally equipped.
Yeah.
So if you don't want to buy the stuff right away, you can always send some work to them to be CAD/CAM milled, to be 3D printed, and you can even make an analog impression, send it to the lab so they can digitally scan it. Or digital scanners are like too small lately. So you can always borrow it from a friend of yours, see the final outcome, see how easy the things are going on, and then you decide whether to buy it or not.
So you don't have to buy all the equipment, all the ecosystem.
No.
You can just go with a regular analog impression, just send it to the lab to scan it.
Yeah. I would say the sequence should be the scanner, CAD/CAM machine, and printer.
Okay, thank you for clarifying this. The next question will be from dental technician. Is the digital technology is going to replace the dental technician, or is going to be a need for the dental technician, the dentist, and mainly for the dental patient?
I mean, it will never replace the role of a highly artistic technician. Yes, there are some parts which the digital is taking over, like most of the posterior restorations. It's easier to go CAD/CAM, and I'm sure there'll be a lot of materials coming out for 3D printing, which will be used permanently in the patient's mouth. It's near future, it's there. But other than that, when it comes to aesthetics, I think there's a big role of the dental ceramist. However, saying that, I can also emphasize that there are now new approaches, which I will try to explain today, like the Rebel, which is a software using tons of artificial intelligence and algorithms to create the most natural and personalized smile design for a patient, taking the facial physical appearance, its perception, and the personality of the patient into the smile design, using the international line, the international visual language, using different lines like perpendicular lines representing strength, inclined lines representing dynamism, rounded lines, calmness, so on. I mean, all the details will be in the lecture today.
That sounds amazing. Because you don't have just a library, just pick up a tooth, a random tooth, and just place it on the random patient.
This is exactly the point. The point is to create a complete different smile for every different patient. I mean, there's so many things which sound nice to you,
Yeah.
but it may not fit with your attitude, with your lifestyle.
Yeah.
So it should fit. If I show a smile, so-called like with an aggressive design, it looks beautiful on the screen. It looks beautiful on a patient who is strong, who is ambitious. But if I place this into a person's mouth who is a very calm person, I mean, it may look okay, but the patient will not feel comfortable.
Yeah.
So this is the main goal of it. So when I connect this to today's digital dentistry, I can simply say that, number one, it will not take the work of ceramists from their hands, but it will be a great plus armamentarium for them to prepare better wax-ups.
Yeah.
Instead of just having a stone model without knowing anything about the patient except for a few pictures, they'll have the whole information on how to design it. And more importantly, because the end result of this approach will be a really holdable 3D printed wax-up, that means this is saving the dentist from making a direct mock-up in the patient's mouth, which is, for many of us, a fear story, because if this doesn't go right, the patient loses the confidence to you.
Also, it's really time-consuming.
So time-consuming. And I know many of our colleagues all around the world avoid doing direct mock-ups. They send it to the lab for a wax-up. Lab does it the way they want, because they have nothing in their hands to hold on to. And then they try it in the patient's mouth. However, like this, just by defining the incisal edge position, which is the starting point of any aesthetic approach, they will immediately have a 3D wax-up. And instead of a direct mock-up, they will place this like an indirect mock-up, the APT, and then boom, it's there. So this will encourage many dentists who are sort of afraid of aesthetic dentistry, who are sort of communicating with the patient by 3D means with a direct mock-up. They will put all this group into dentistry, and that means we will need hundreds of more dental technicians to produce the final products.
That sounds great. That sounds great.
So it's a great win-win situation.
So no one is losing from it's
Nobody
not a battle.
Should lose.
But
I mean, if someone will lose, nothing will last forever.
Yeah, that's true.
Everybody should win.
My next question will be: is digital design it's a must for every clinical cases of yours, or depends? Sometimes you are going to do a case without the aid of digital design, or
well, the main answer to this is that it is a must that you should have a design. Whether it be analog or digital. So if you're confident with your hands, if you have done thousands of that, you may, of course, go analog. There's so many talented dentists out there who can do it like in a heartbeat. But if you are not, if you don't feel comfortable, if you find it too time-consuming, then you try it with digital. I mean, today I will try to explain my 35 years of dental career, how I first came out with the idea of a mock-up 30 years ago, and then how it improved to today's direct mock-up, indirect mock-up, and now the digital mock-up. I still love to work with my fingers. So I love it myself doing it still analog, even though we created this Rebel, which is a digital 3D wax-up. But for many cases, we use it because it's so time efficient and very precise.
Should the digital workflow be in hands of the dentist or the dental technician, or should be a combination of both?
Both plus the patient.
Plus the patient.
It's
so the patient should be active in all the decisions?
Well, in some parts.
Yeah.
I personally don't want to be them active in all procedures because sometimes they can get confused because we have so much information in our brains to load into this design, which they don't need to get into. But in the final decision making, they should definitely be in that. Regardless of whatever is going on, dentist should be the team captain of this whole procedure. But I always say 50% of our success is definitely the dental technicians. So their role in aesthetic dentistry is tremendous, and I have great respect to what they're doing since years.
Thank you for being with us today here. Your presentation will start shortly. That's why we are going to go into the conference room with you and see you talk more about all the digital design and all the practice or your experience with digital software.
Well, it's amazing, and I should congratulate all the organizers here. There's an amazing audiovisual setup, a huge hall, and you have 800 seats there.
Yeah.
It's already packed,
Fully
and
booked.
more people wants to come in. I don't know how you will handle this, but for sure it's going to be a great day for everybody. In a few minutes, it starts at 11:30.
Yeah, we have something like 5 minutes.
Yeah.
Thank you a lot for being with us here today. We are going to see you now your presentation. Yeah. Thank you.
My pleasure.
Thank you. Have a good day.